Good afternoon, yeah. Good afternoon, everyone. This is Dr. Poornima Mathur. Yet again, आज हम एक कोई कॉमन टॉपिक डिस्कस करने वाले हैं जो हम सबके माइंड में क्यूरियोसिटीज लाता है. Like how do we prepare for fertility treatment? How to proceed about it? How do we start? And when do we start? So, just a second. Excuse me. It is right there. Okay. Just one second. Mm-hmm. Am I audible? I'm audible? Okay, so how do we prepare for a fertility treatment? What are the things that need to be done? So, सबसे पहले, there are many questions in our mind. Like, when do I start getting a fertility treatment? What needs to be done? And what is preconceptional counseling and who should get it? When is the time to consult a doctor? How do we prepare ourselves? Does my partner also need to take certain precautions or take care of certain things? And what are the different treatment options? And which one हमारे लिए सबसे अच्छा कौन सा हो सकता है? So when do we start planning? So planning for pregnancy like एक बहुत ही major decision होता है जो couple मिलके decide करता है. In today's era, we believe in more freedom of the couple. आपके पास decision की power है. Like when do you want to start your family? Though हमारी तरफ से we would advise कि it would be better if you can plan your first pregnancy before 35 years. Earlier हम कहते थे it should be before 30 years. A couple अगर जो late planning की सोच रहा है, the couple is thinking कि नहीं we are right now I'm occupied in my career or my business or for whatever reasons like your health or family issues. If in case you cannot plan your pregnancy and you're concerned about your fertility, we always have the option of fertility preservation. So now fertility preservation is what? Like if for instance a couple who's been married for just 2 years, they had their age is somewhere around 35 or beyond, and they are not looking forward to pregnancy right now. So we cannot force a couple ki fine since you are 35, though you've been married for just 2 years, आप pregnancy plan करना शुरू करो. If the couple intends to have a baby after the age of 38, 40, so we have an option of fertility preservation for them. They can preserve their gametes, their embryos, and use them later on for a pregnancy. If अगर हमारा couple है who has some coexisting medical conditions, say for instance अगर किसी को diabetes है या hypertension है या any other medical comorbidity, in that case a couple might consider कि हम early pregnancy plan कर लें और early consultation ले लें so that they can optimize their chances of conceiving. So when do we consult a doctor? आइडियली अगर हम देखें अ कपल जो प्रेगनेंसी के बारे में सोच रहा है, they should have a preconceptional counseling 3 to 6 months before planning of pregnancy. Why do we say 3 to 6 months? Because हमें इतना टाइम चाहिए so that we can optimize their health and maximize their chances of pregnancy. If in case आपने preconceptional counseling नहीं ली है and you've been trying to conceive and it's been 8 साल अगर हमें unprotected relationship रखते हुए हो गया and we've not been able to achieve a pregnancy, that is when you need to consult a fertility specialist. If you are beyond the age of 35 years, in that case, we would suggest कि आप एक fertility specialist को consult करो after 6 months of active trying. Now, do we have to wait for 6 months or 1 year? No, it is not necessarily. अगर आपको already irregular cycles हैं and your cycles are not complete, So in that case, you can consult a doctor as soon as possible. Now, अगर if I have my cycles every 35 to 40 days or I have excessive flow during my cycles or मेरी cycles में मुझे decreased flow है, if there is some issue, so you have to consult your doctor as soon as you think of getting pregnant. So, what is preconceptional counseling and what is its role? Now, preconceptional counseling जो है वो हमारे तीन मेन मोटिव्स के साथ होती है कि if there is some pre-existing risk that the couple already has, अगर कोई medical disorder है which can prove a hindrance in conceiving or which can affect our chances of getting pregnant, so we can identify and rectify it. If in case the couple does not know, at times the couple हम unaware होते हैं कि what would be the best practice to get pregnant, what is a fertile period, हम optimize कैसे कर सकते हैं. So this is also a chance to educate the patient couple regarding how to proceed, what are the supplements that needs to be taken, what intervention is required. So, a preconceptional counseling when you're planning to conceive at least 3 to 6 months before is ideally required to help you smoothen out your journey for pregnancy. Now, what do you expect from a preconceptional counseling? अगर हम जाते हैं, if we go, now where do you go? First is if you want to go ahead for a preconception counseling, you contact a nearest gynecologist or a fertility specialist who can help you out with identifying the problems and giving you a solution to it. Now, what do we expect out of it? As soon as you go to a doctor for the counseling part, they will take a detailed medical history so that we can identify the pre-existing conditions or risk factors that you have, or certain things which have a high incidence in your cases. It will be followed by a physical examination कि आपका एक thorough physical examination होगा, including gynecological examination to rule out any vaginal infections. A pelvic ultrasound gives us a detailed information. हमें एक information मिलेगी regarding आपको uterus कैसा है, आपकी ovaries कैसी हैं, ovarian reserves, how do they look, and any other coexisting pathology, if any. This is combined with a few blood investigations. Now, blood investigations like there are certain hormones in your body which affect your well-being and your fertility potential. If you are anemic or your thyroid levels are deranged or the serum prolactin, these all hormone levels are assessed. A simple blood test as AMH will give us an idea into your ovarian reserve. So once all these investigations and physical examination and everything is done, you can have a detailed discussion as to what all risk factors are there, or if everything is healthy, how do we proceed about it. Now, this preconceptional counseling will help the couple relax. एक बार आपको डिटेल अंडरस्टैंडिंग आ जाती है कि how can we go ahead with it, and then you are relaxed as well when you know that everything is normal and you would not have any trouble getting pregnant. Now, if in case we need a fertility treatment, how do I go about it? Now we know that you need a fertility if you go for a preconception counseling and your doctor says there are certain concerns which might mandate कि हमें कोई intervention लेना पड़े, or we've had 1 year of active trying if we are less than 35 years, or more than 35 years and 6 months of active trying for pregnancy, or we have a coexisting gynecological issue which we know can interfere with our potential to get pregnant, or a male partner factor which we know can interfere with pregnancy. So that is when हमें fertility treatment लेना पड़ेगा. And so how do we prepare ourselves for fertility treatment? For instance, if we've already chalked out a plan कि हमें ये so and so fertility treatment लेना है. How do I optimize myself? The first and foremost is you have to cut back on your substance abuse. Now, substance abuse may it can be smoking, it can be alcohol, it can be tobacco, or it can be any recreational drug that we use. Now, smoking has an adverse effect. In no amount smoking can give you any benefit. Smoking will have an adverse effect on both the male and the female. Males में it affects the quality of the sperm. Sperms की motility affect होती है. Now, sperms are the male gametes जो motile होते हैं, that is they move, and they are supposed to move from the vagina to reach the egg to give us a pregnancy naturally. Now, उनकी ये जो motility है, that is seriously affected with smoking. Smoking in women can affect the quality of the eggs and decrease the chances of pregnancy. Similarly, alcohol and tobacco they can cause significant DNA damage and significantly reduce हमारे chances of pregnancy. So, if in case we've decided we want to conceive or we are starting with the fertility treatment, we have to cut back upon our smoking or alcohol or any other substance abuse जो हम दे रहे हैं. At times, it cannot be like you would say, how can I overnight stop 10 to 15 cigarettes per day? So, this is when you can actually take the help of the doctor or a psychologist, and we can help you transition this journey where we can cut down on the substance abuse. Now, आज के era में it is very common that we take coffee. We need caffeine to maintain a hectic day, busy day. We're taking cups of coffee. So now, is this coffee helpful? Is this coffee unhealthy, or is it going to make no impact at all? Now, caffeine अगर हम कहते हैं 200 mg per day से ज़्यादा लेते हैं तो that they can significantly affect हमारी fertility potential को. So caffeine is not only in coffee, it can also be there in the soft drinks that you take. Or next time you pop that headache की pill, headache के लिए आप जब medicine लेते हैं, even that can have caffeine in it. So we have to limit our caffeine intake. It can be, it is more so evident people who take 5 to 6 cups of coffee or black coffees per day. This is where we have to limit the caffeine intake so that we can optimize हमारे chances of pregnancy. Now, the healthiest weight. We have to figure out which is our healthy weight and try to reach there. Now, आपका जो weight है, that is complemented with your height, and we calculate the body mass index. Now, if your BMI is more than 30, that is when you are obese. So, if you have obesity, if our weight is on the higher side, that is where we are at a higher risk of facing difficulty when we are getting pregnant. Our journey of fertility can become a little difficult. And even our pregnancy का course जो है 9 months हमारी जो pregnancy की होते हैं, they can be severely affected, impacting on the baby and the mother की health. Mother की health in the form of diabetes, blood pressure, baby की growth कम होना, and all these things, and even the mode of delivery. So before we go ahead with pregnancy planning or fertility treatments or fertility planning, we have to get our weight in the optimal range, somewhere between 20, under 25 BMI. So how do we work out on it? Now it is a very common practice these days with all the social media stuff. People think, okay, now if I have to lose weight, we'll follow fat diets, maybe go on a complete starvation mode or on a liquid diet mode or a keto diet mode. So whatever diet that you want to follow should be in consultation with your doctor or your nutritionist so that you do not end up compromising your own health. At times we have sudden weight loss, but in turn we end up compromising the nutritional balance in our body. So when we are aiming at a healthy weight, we are aiming it at a more healthier way and in a more sustainable manner. So that would include both your diet as well as your lifestyle changes. So in diet, we need to make sure that we have adequate amount of fruits every day, our protein intake is maintained, the carbs are restricted, the fiber diet is there. Now that we can take the help of a nutritionist so that the nutritionist can help us figure out a diet for our individualized diet approach for your particular body, where your nutrients are supplemented and our health is given the top priority and we reach our desired weight goal. Now, in the lifestyle changes, we would like you working out at least 30 minutes of workout 5 times a week. This is going to help us achieve our weight in a very healthy manner and sustainable manner. So once our weight is in the normal range, now this is the same thing is applicable to people who are underweight, who have a BMI of less than 70. If you are too underweight, that can also impact your potential of getting pregnant or achieving a pregnancy. So if in case we are underweight, we need to find out if have an evaluation regarding the hormonal profile. So that's to rule out any medical factor leading to it. Have a more high protein diet so that the muscle mass and everything is maintained. And try to get into the normal weight range, that is 18.5 to 25. Now, prenatal supplements. Now, what is the role of prenatal supplements? If I'm already on a healthy diet, do I need to take it or not? So, when you go to your doctor, there would be certain prenatal supplements advised to you. Now, what are they basically? They are basically to optimize your health. Now, the most common supplement that we keep on advising everybody who's planning for pregnancy to take is the folic acid supplementation. Folic acid in the strength of 400 microgram per day, if taken 3 to 6 months before planning pregnancy or before getting pregnant, उससे हमारे बेबी के अंदर न्यूरल ट्यूब डिफेक्ट्स इन द सेंस एनी डिसऑर्डर रिलेटेड टू द ब्रेन दे आर सिग्निफिकेंटली रिड्यूस्ड. So, folic acid supplementation is advised before you get pregnant. So, 3 to 6 months before, जो हमारी preconceptional counseling है, तब से we start taking our folic acid supplementation. Now, in certain cases, the folic acid that is required might be in a higher dose, like people who have diabetes, who had previous history of baby with neural tube defects, or we are already on certain anti-epileptic drugs which can affect the availability of this vitamin in our body. Similarly, there would be other supplements depending upon your assessment, vitamin D supplementation or vitamin B12 supplementation, which your doctor would prescribe you to optimize your health. Now, stress. Now, stress is a very significant factor that plays its role आज के era में, and it is very underrated as well. We do not realize we are under constant stress of our work life, of our personal life, and the physical stress because of the hectic life schedule that we have. Now, this stress has been scientifically proven to impact your health, the quality of your eggs, your chances of getting pregnant, even your cycles. So, how do we manage it? Like, we cannot eliminate the work life stress that we already have. So, we have to find out coping mechanisms so that the stress does not impact our health. So, of this, the most important thing is the yoga and lifestyle modification. So now yoga or breathing exercises that done are significantly reduce the impact of stress on your body. Similarly, we can have different mechanisms to reduce stress. Maybe you have a buddy, or maybe you have a hobby practicing class, or you have a group where you can discuss out, especially if related to fertility. You can have infertility groups where you share your journey and help each other manage their stress. Similarly, lifestyle changes. Now, most of us have a very sedentary lifestyle these days. We have a very hectic schedule. We start at 8 in the morning till evening 8. We are working. We do not have sunlight exposure, exercises, or time to have a healthy diet as well. So, this lifestyle has taken its impact on people. Hence, we have the increasing incidence of infertility in the recent generation, or infertility is the new pandemic these days. So, how do we cope up with it? Now, we have to make sure that we have some amount of activity in the day. If we have a sedentary lifestyle, we need to make sure that we have 30 minutes of active workout later in the day. We have to try to maintain a circadian pattern of sleep, like avoid late night sleeps, get at least 7 to 8 hours of sleep every day. Include healthy diet. If gymming is definitely, it is not that everybody has to go to gym. If I'm saying active with 30 minutes of workout, 30 minutes of workout can be in the form of cycling, it can be in the form of walk, swimming, or playing your favorite sport. That reduces your stress, keeps your body healthy, and gets you time to bond socially with your friends as well. So this is just a pyramid showing that how the nutrition, if you take active nutrition, which and improve your sleep, may get your emotional calm down, that all leads to better hormone signaling, detoxifies your body. The exercise further helps it out, and this improves your fertility. So this was in general for everyone. Now I feel in infertility, we'll keep on laying on more stress on women, and men are often the ignored ones. But we cannot forget that half of the baby is contributed by men. So, how do we work out on men's health? Apart from the routine lifestyle changes, in order to improve the semen quality, like if we are trying for pregnancy, we are aiming for fertility treatment, how do we optimize? So, is apart from the lifestyle changes like eating healthy, sleeping well, exercising, we have to make sure that you wear boxers or loose fitting clothing. If your workplace is exposing you to high temperatures, limit the high temperature or the chemical exposure. Try taking breaks in between so that you lower down the temperatures in between. Limit the caffeine intake that you are having. The smoking and alcohol can have a significant impact on the sperm quality and sperm motility. We've already discussed that. We have to avoid it or cut it down. Manage your stress, healthy diet, and maintain a healthy weight. So once we've started optimizing our fertility, and if we are in the need of fertility treatment, so does fertility treatment always mean IVF? What if I go to a fertility doctor? Now, people these days, we've seen couples being scared. Okay, the moment we step into a fertility clinic, what if we are offered only IVF? So it is not that. There are different treatment modalities, and what treatment modality suits you best is decided by your treating fertility specialist. It is a very individualized approach. Now, there are different modalities starting from as simple as ovulation induction, where we give you medicine so that your egg forms, it ruptures, and we help you have a timed relationship during that time and achieve pregnancy with that. So this is more so suitable when people have anovulatory cycles with normal male parameters. When the male का evaluation is absolutely normal, but हमारी lady में अगर egg बनने में हमारी problem हो रही है. This is usually our first line of treatment. If that does not work, we have an intrauterine insemination. Now, what is intrauterine insemination? So, intrauterine insemination में the washed semen, that is the male semen, is washed, and the good quality or the processed semen is placed inside the uterine cavity just when the egg is releasing or rupturing. So now it is does not involve any surgery. It is an OPD procedure and a painless one. It takes 10 minutes to perform. Now, intrauterine insemination is primarily for those who have unexplained infertility or where there is a male factor infertility, a mild male factor one. Whether or not you are a candidate for it would be discussed with you by your treating doctor. And next in line comes the IVF or ICSI, which we know where we give you injections, make your eggs, take them out, fertilize them with your partner's sperm, make the embryos and keep them inside your uterus. So with all these modalities, whichever suits you best would be discussed by your doctor. The journey is difficult, but we have to start it. Let us help you make this journey much more smoother and an enjoyable ride. So for any queries, feel free to contact Oasis Fertility. Here we have all the latest technologies and are ready to help you at any point of your journey. Thank you. Any queries? What not to do during fertility treatment? First thing is what not to do is drinking, smoking, alcohol, having a sedentary lifestyle. The most important thing is not having faith in the treatment, or um, basically it is you have to strictly follow what your doctor says. Not skipping the medical compliance to medicines is also very, very important during fertility treatment. So how do you prepare your uterus for IVF? So your uterus would be, this is something preparation that your gynec is usually, your fertility doctor is going to take care of. Your uterus, unless and until it is a hypoplastic one, they is usually ready for pregnancy. The doctor would give you certain medicines to make your uterus healthy, to make your lining develop. You in your part can contribute by going for a more healthier lifestyle, which will help ensure that the medicines have a proper effect on your uterus. When is the best time to start fertility treatment? Ideally, it is if 1 year of regular, uninterrupted, unprotected intercourse you've had, and you've not been able to conceive, or if you are more than 35 years and you've had 6 months of active trying and you've not been able to conceive, it's time to see a fertility doctor. Okay, I think that's it. If you have any queries, please contact on the given number. We at Oasis Fertility have all the latest modalities to help you out in all regards. Thank you so much.